There is consensus within the scientific community that the global climate is changing and that this is affecting human health. Water is the primary medium through which climate influences the Earth's ecosystems and therefore people's livelihoods and well-being. Human activities have driven this planet to the current climate change, and the emphasis within the health sector is on the ability of our human species to adapt to changes that have become inevitable. Climate changes, urbanization, rural development, water availability, water quality, agriculture and food security are intertwined determinants of population health and health equity. Climate change threatens human security by impacting public health and is expected to pose direct threats to health by causing more severe storms, floods, droughts, and fires, with consequent disruptions in water and food supplies and medical and other services. The subject of climate change and public health is not new, and the World Health Organization, as well as PAHO, have published documents and held workshops over the last 2 decades addressing the effects of climate change on public health. Increasing concerns and evidence on public health impact led the World Health Assembly in May 2008 to approve a resolution for the WHO and member states to implement actions to protect public health from climate change. The theme of protecting health from climate change was chosen to commemorate the World Health Day 2008 to make WHO concerns on the effect of climate change on health more visible. As a consequence, a regional plan of action to protect health from climate change was prepared for the Americas in consultation with member states and with national committees on climate change and human health. The strategic objectives of the Regional Plan of Action for the Americas include evidence for action, providing technical cooperation for implementing adaptation mechanisms in the health sector, and providing leadership both to protect people from climate change and promote healthier environments for all. In order to maintain our advances and achieve the MDGs, water, climate change, and equity should be tackled together in a sustainable development initiative such as the WHO Water Safety Plan framework. This aims to ensure safe drinking water through good water supply practices. It encompasses the prevention of contamination of water sources, the treatment of water to reduce or remove contamination to meet the water quality targets, and the prevention of recontamination during storage, distribution, and handling of drinking water. Combined, water sanitation and hygiene interventions can reduce the prevalence of waterborne diseases and related deaths up to 80%. No public health intervention has greater impact on the development of a nation and on individual and collective health than water, sanitation, and hygiene combined. This is especially relevant to children, pregnant women, and the elderly. The health sector must add its voice, loud and clear, to the growing concern about climate change. We have succeeded in securing a high profile for health into the development agenda. Now we must push hard to place people's health at the forefront of the climate change agenda in order to achieve health for all in this century. Ladies and gentlemen, universal access to water and health is a critical component of human security and is mandatory to secure a peaceful world for all. Thank you.